I wanted to talk a little bit today about bioidentical hormone therapy for women and what your options are, because there's a lot out there and it can be a pretty overwhelming topic. So I wanted to make it simple and a lot more understandable too. So when you're going through perimenopause and then menopause, you may find that you need support, not just from an estrogen standpoint, but also from a testosterone standpoint and a progesterone standpoint. And everybody's different in what they need. If you're still getting menstrual cycles, we don't necessarily want to put you on estrogen because you're already making estrogen, and too much estrogen can actually make you feel worse. So too much estrogen can feel like PMS symptoms, to where maybe you're getting breast tenderness or bloating or irritability, and we don't want to do that. But it could be that you actually need some progesterone support, because as you go through perimenopause and menopause, your estrogen can start to deplete a little bit, but that's not as noticeable as your progesterone depleting. And when your progesterone depletes, then you can feel estrogen dominant symptoms as if you were to have too much estrogen. The other piece of this is testosterone. Testosterone, as women, we need. We don't need near as much as men, but we still need it. And testosterone is kind of your good upper feel-good hormone. So it helps with mental clarity, with endurance, with feeling like you want to exercise. And then when you do exercise, you're able to put on more muscle mass. And so when we notice when testosterone's dropping in females, you may be working out the same, but not building the muscle you used to be able to build. And then testosterone's also important for even sleep. Lots of times when you wake up sweaty at night, that can be a testosterone deficiency. And also, of course, libido. With these three hormones, there are different ways to replace them. And this is always something worth finding a provider that knows what they're doing on this. Typically, what I found is a lot of OB-GYNs will prescribe straight up Premarin for estrogen support. And Premarin is a pill that's been around for a while, but it's not bioidentical, meaning it doesn't match the estrogen that we normally make in our system. Premarin instead is made from pregnant mare urine. And so it's essentially giving you horse estrogen, which is way more than what our body needs. And that in particular is linked to cancers like breast cancer, the things that we're concerned about with hormone therapy. So what I recommend and what I often prescribe or only prescribe is bioidentical hormone therapy, meaning these are hormones that look just like what your body already produces. And we can do this in the form of testosterone or progesterone or estrogen or a combination of these. There are many ways to do this. What I typically start with for women is doing a type of topical treatment, meaning making estrogen into a cream, or maybe even there's estrogen patches that you can do that are estradiol, which is bioidentical. If we were to go the cream route, a lot of times we can put whatever amount we want into the cream, and I can prescribe it and send it to a compounding pharmacy where they can then give you the cream and you can apply it. Same thing goes with testosterone for women. There's not a patch for that, but we can compound it into a cream. And then you pick it up at a compounding pharmacy and you apply it to your skin, typically the thinner areas of skin like your inner thigh. As far as bioidentical compounding or bioidentical hormone therapy goes, not all of it's covered by insurance, unfortunately. So the commercially available estrogens can come in a patch form or a pill form or a vaginal cream. I'm not a big fan of the estradiol pills because they have to be metabolized through your liver, and there's more concern with things like blood clots and adverse effects or side effects with these. So typically the transdermal or the applying to your skin version is much better. So I know this is a lot. I'm going to kind of break it down as far as what does a typical regimen for bioidentical hormone therapy look like. A lot of times what I'll do is if you're in menopause where all of your hormones are low and we're wanting to replace your estrogen, testosterone, and progesterone, oftentimes we'll start with combining a cream where we can put estrogen and testosterone in it and sending that prescription over to a compounding pharmacist where they give you the cream at your dosages. And I always start low because we don't want to have any side effects from getting your dose too high. You can take that cream and start using it once a day. If you have a uterus, so some people who've had a hysterectomy do not have a uterus, but if you have a uterus and we give you estrogen, you can start to bleed again and have a normal cycle, which we do not want when you're postmenopausal. So we also pair this with oral progesterone that you take at bedtime. And this is a little pill that you take. It's bioidentical. In most women, it helps you sleep a lot better and helps balance out your symptoms. So you do the cream in the morning with the estrogen and testosterone, and then you take the progesterone pill at night. And that's a pretty simple regimen, and we get you started at lower doses, see how you feel, and then we can adjust those doses as you need them. Sometimes you're sensitive to testosterone, so maybe we leave that out. Or sometimes you're sensitive to estrogen, or there's a medical reason why estrogen is not a good idea for you. Sometimes we leave that out, or we keep it very low. So all of this we can customize really easily. Some women really don't like the creams. They can kind of be a pain if you're not used to applying that in your routine. With the creams, you want to wash your hands really well, especially if you have little kids that you're holding. You don't want to touch anybody else with the cream. So for that reason, some women opt to have what's called troches or RDTs, which is rapid dissolving tablets. These troches or RDTs, same concept as the skin application, but you put them under your tongue or between your tongue and your cheek, and they dissolve through your mouth, through the blood system in your mouth, through your capillaries, and into your bloodstream. So these can be a good option. It's kind of like dissolving a mint every morning. And we can put estrogen and testosterone in there, send it to a compounding pharmacy, they dispense it to you. And you do these once a day too. So what that regimen would look like would be you do a dissolvable once a day with your estrogen and your testosterone, and then you take an oral progesterone pill, same as before, at night. Progesterone's best taken at night because, again, it can help you sleep and make you tired, which is a good thing at night, but not during the day. There's other options too. So that's where we can talk about the estrogen patch, which I have a lot of women do really well on. The cool thing about the estrogen patch is I can call it to a regular pharmacy like CVS, and sometimes insurance will cover it. And this patch is still estradiol, still bioidentical, but you just put it on like a sticker and you leave it and change it twice a week. So 2 patches a week. And I really like the patches a lot and have had a lot of women lately do well with them because it keeps that absorption very steady versus the cream and the dissolvables. You will have a little bit of a peak where your hormones are higher during the day and then they'll go back down, and depending on how you metabolize them, you might feel lower at night, and we have to adjust based on that. But with the patches, we can keep you steady. They don't make testosterone patches though. So typically then you end up doing an estrogen patch and then something extra with testosterone, and then you still take the progesterone at night. As far as other options, there are the pellets, and hormone pellets they look like little tiny Tic Tacs that you've sucked on a little bit. And for women, usually those Tic Tacs you end up getting about 1.5 worth, and we surgically implant them into the fat kind of right above your butt. And so it stays into that fat tissue and it absorbs over the course of roughly 3 months. The pellets do get your levels up really high. So it's not my first go-to for women for a couple of reasons. One, because I don't love getting levels higher than we need to get them, because you also are at risk for more side effects. So for example, too much testosterone and you can get head hair loss or increased body hair growth or facial hair growth. We don't want that. But if we put the pellets in and we get that, I cannot take them out. They have to dissolve and go run their course. So because of those reasons, pellets aren't my first go-to, but there are some women that just seems to hit the mark for them. The way that pellets look or the way that a pellet insertion works is it's usually done in the office, and the whole procedure takes 5 to 10 minutes where we just clean off the area, numb you up, and like what you would have been numbed up with had you gotten a dental procedure. So we use some lidocaine in there, and then we make a little incision about what I can make with my fingernail. And then we push the little pellets through, and then we put a little bandage on there. So pretty easy, but again, not my first go-to. I ran out of things to say. You can cut it right here. Anyways, this is my spiel typically on what I tell women when they ask about hormone therapy. And the more you know, the better, so that you can understand what your symptoms are, what may be causing your symptoms, and if hormone replacement is something that you're looking into because you've tried lifestyle, nutrition, supplementation, and are still just getting symptoms, and you've talked to your medical provider and decide, you know what, this is the next best step. You need to know your options, because otherwise you may land with a regimen that either just doesn't work for you or may cause more risks than you need. And when it really could be that you find something customized and do really well on it.